Hello and good afternoon, everybody. Welcome. Welcome to our webinar with GLI, Mental Health and Leadership, Wading Through the Storm. We do have some folks that have just joined us, so welcome. And I think there will be a few more people coming in the next few minutes as there's just some folks settling in, maybe grabbing their lunch before they join us. So I'll just wait one more minute and hopefully people are finding their way in. Okay. So as people are coming in, I'll get us started. Welcome to this webinar as we wrap up Mental Health Awareness Month. Thank you for joining us. I know that it's a very busy time, and so for you to take time out of your busy schedule and come and listen to our esteemed guest speakers today and really just engage in conversation with us around this topic. We're really glad that you're here. My name's Laura Boyko, and I'm your panel host for the next hour. I'm a leadership and team development consultant with Global Leadership Initiatives here in Toronto, Canada, and I've held leadership positions over the last 15 years in healthcare and education, leading, developing, and transforming over a dozen teams. As a social worker and certified coach, I love digging deep into how teams work and how we as leaders can create engaging and supportive work environments. For those of you who are new to GLI, Global Leadership Initiatives is a Canadian incorporated leadership development organization with over 36 world-class expert consultants in leadership, sustainability, management, and team development from countries around the world like Canada, the US, South Africa, Russia, and China. GLI exists to develop excellence in leadership globally, and we do this through the 4I process of inquiry, intervention, impact, and iteration. This 4I approach to leadership development is achieved through the books we write, the courses we develop, the workshops, podcasts, and webinars we deliver like this one today. GLI leverages the best of leadership development theory and practice by bringing together a talented pool of highly experienced leadership development experts, researchers, and coaches that will help individuals develop and positively impact organizational processes. If you want to learn more about GLI, check out our website at globalleader.ca, and it's also in the chat if you're interested. And you can become a member with us and have access to free coaching, leadership development courses, and our leadership forum where you can interact with leaders from around the world. If you like today's session, consider joining us next month, where we'll be bringing together Indigenous leaders from across Canada to discuss leadership and walking in two worlds. I hope to see you there, and I'd love it if you could let us know where you are in the chat right now. So just so you know, all of our participants are muted. I can see that we've got a total of 14 people here with us today. Again, thank you for joining us. If you have a question or comment, feel free to pop it into the chat box and we'll get to your question, but we're also going to have a short breakout room towards the end of our time together today, so you can speak directly with some of our panelists. And before we get started, I want to let everyone know that we're very excited that you've taken time out of your busy day today to be here with us. And as leaders or people that are interested in leadership, it can be hard to step away from our day-to-day duties to focus on our own development. Conversations like this one we're about to have are so important to helping us stay current and fresh with ideas. Leadership can be a lonely place at times, so we're happy to be able to provide today's topic. At this time, I'd also like to provide a land acknowledgement. And in the spirit of Canada's Truth and Reconciliation Commission of Canada, we're here today to acknowledge that we're gathering from a variety of traditional lands of Indigenous peoples from Canadian territories and beyond. We recognize all those many First Nations, Métis, and Inuit whose footsteps have marked these lands for centuries. Today's session marks the end of Mental Health Awareness Month. While we have made great strides in reducing the stigma around mental health in the workplace, it is still present. Based on a recent report by Mindshare Partners, 60% of employees have never talked to anyone at work about their mental health in the last year. Employees are afraid to talk about mental health at work, and yet 61% said their productivity was affected by their mental health, and that 37% said their work environment contributed to their symptoms. The last year has exacerbated any issues that might have been present. According to another study by Oracle and HR Research, a study with more than 12,000 employees, managers to C-suite level executives across 11 countries stated that COVID-19 increased workplace stress, anxiety, and burnout for people around the world. According to the Mental Health Commission of Canada, mental illness is the leading cause of work disability, affecting almost 7 million working age adults. The cost to employers from losses related to turnover, absenteeism, presenteeism is over $20 billion annually. Given these numbers, it's important to consider how we as leaders can support our teams and ourselves to maintain good mental health and well-being. Today we have two panelists, Dr. Jenni Frumer and Justine Lee, who are joining us to discuss how they have used their leadership skills and expertise to support the mental health of their employees and teams. Let me quickly introduce them to you. Justine Lee is a registered nurse with 20 years of nursing and leadership experience in not only mental health, but medical, surgical, post-anesthetic, and geriatric emergency medicine. She has held roles as an educator and moved into leadership. She's currently the clinical manager for the geriatric psychiatry unit and the geriatric mental health community outreach team at Ontario Shores Centre for Mental Health Sciences in Whitby, Ontario, Canada. Justine holds a master's degree in nursing and health systems leadership administration and is currently completing a master's in pastoral studies. She's a certified health executive and a busy working mom to 2 boys. Welcome, Justine. Dr. Jenni Frumer has over 3 decades in nonprofit leadership and is the president of Jenni Frumer and Associates LLC, offering organizational and leadership development, including executive coaching, and is an expert consultant with GLI. Jenni serves as an officer on the board of the International Center for Multi-Generational Legacy of Trauma, and as the director of the Now for Holocaust Survivors initiative at Morse Life Health System, she has established community-based trauma-informed care services for Holocaust survivors and their families. She's a licensed clinical social worker, has a master's degree in education, and earned her PhD in business human capital management. She teaches graduate courses in public administration, social work, nonprofit leadership, and human resources. She's published articles on community-based models of service to older adults and peer supports. Jenni is a team leader for the Council on Accreditation and has worked with the U.S. Marine Corps. Dr. Frumer continues to bring rich and diverse expertise to a variety of human service and business settings, including within EAP programs for Fortune 100 to 500 companies. We're in great company this afternoon, and I know you'll gain so much from these incredible women's experiences. So welcome, Dr. Frumer.
Thank you.
Okay, so we've got lots of folks coming in. I just wanted to check here quickly. We've got people from the UAE. Welcome. Welcome Osas from Ireland. Welcome Dawn from Curtis. Welcome, welcome folks from Coburg. Awesome. So we've got people in here from all over the world, and that's why we do these. So let's get to our first question, and I'm going to ask, and if I'm going to just be very open and casual with us this afternoon, so I'm going to refer to Dr. Frumer as Jenni, her first name, and Justine. So Jenni, what are some of the signs that you look for in your team members that may indicate to you that someone is struggling?
Hi, Laura, and thank you. And it's such a pleasure to be here with Justine as well. So really honored to be on this panel today. Maybe it's because I'm a clinical social worker and I've spent so much time, working with mental health, but I think I always like to make the sort of differentiation between mental illness and mental health. Mental illness is really diagnosis, and there are many people with mental illnesses working in all kinds of sectors and in all kinds of organizations. But I think when we think of mental health, I tend to think of it more as kind of mental well-being, if you will. And so I tend to really look for subtle changes sometimes around things like people who I know, employees who tend to be struggling with work-life balance, or I notice that I'm having to repeat myself, or in a group, other people are having to repeat themselves because someone may have difficulty concentrating. Um, Someone who might have been, oh, I'll volunteer to do that, and all of a sudden seems to be more withdrawn and maybe lacking more confidence, or just noticing there's something else happening. Additional sense of anxiety. Again, they can be really subtle. And I think we've noticed over the past year, because we haven't been in rooms with people and teams, and it's more Zoom, you could sort of, notice maybe more fidgeting, things that are happening. And procrastination, when people who generally are on top of things and then all of a sudden deadlines come and go. Those are the kinds of things, and there are many more, but I just want to really emphasize that well-being is all of our business. Well-being is something that affects all of us. And so mental health is, to me, a concern that all of us at one point or another are struggling with or will struggle with.
Excellent points, Jenni. And it's well, a good thing that you're a social worker. You have that background to notice that human behavior. Justine's also a nurse, and nurses are trained in human behavior as well. So Justine, in your experience, what might be some additional signs that you've seen in your team members, or that you look for in team members, that might indicate to you that someone is struggling?
Yeah, and thank you as well for having me here today. It's an honor to be amongst a great panel today, such as Dr. Jenni, so thank you. I would have to echo everything that Jenni has said. And really for me, I think it's important to trust your gut. When you have that sense that something is not what you would typically see in your team or even in your own colleagues. Relationships for me is quite key, and that alone in itself is having those everyday conversations, knowing who that individual is as a person and not just as a staff or a colleague. They are a father, a brother, a wife, a sister, and being able to know them in their behavioral changes that Jenni had identified earlier. Those are quite key in the everyday to day, because we are busy. We all have work to do. And when we can trust our gut and be attuned to those behavioral changes, those are the opportunities that you don't want to miss, that opportunity.
Absolutely. I love that. Trusting your gut. I always say it's the art and science of the work that we do. And sometimes it's being more artist than it is scientist. Justine, what principles do you use in your leadership to support others with their mental health? Is there certain things that you sort of espouse in your leadership style?
I would say in general, I really believe in authentic and servant leadership. Those are the big, major aspects of the way I relate to people, the way my belief system, and really having that courage. I believe in courage and having vulnerability to have those conversations with my team members. And when you go in with an honest and a compassionate heart, they know that. They can sense it. And it's when you approach it in that way, it allows for that conversation and that opportunity. So really, I believe wholeheartedly in spirituality and being able to serve my team.
Awesome. I totally agree with you on the authenticity and being open and compassionate. Jenni, same question. What principles do you use in your leadership to support others in their mental health?
Yeah. I tend to think language is really very important, and we come from such diverse backgrounds, and different language mean different things to different people. So finding a way with the authenticity to also really talk about, this is a challenging time for all of us. We're needing to be more agile. There are things happening in our environment that we can or can't control. There are things within our own work-life space that we may or may not be able to control and feel good or not so good about. To make it an environment that really supports reducing a stigma associated with mental health. it's okay to talk about difficult days or days where you haven't slept because your 3-year-old was up all night not feeling well, or there's something else going on at home or within the organization. You may be struggling through a relationship. So it's sort of this the authenticity, but it's also creating a culture and really supporting the culture. So it's not just talking the talk, it's then figuring out how to walk the walk so that people feel like they can walk into a supervisor's office, so they can walk into a colleague's office and say, it's just not working for me today, and get support for that, even if we may not be able to know immediately how to fix that, and the sense of burnout or compassionate fatigue or anything else that may come from the actual work that we do related directly to our performance and can impact that.
Mm-hmm, mm-hmm. How have you seen the mental health of employees be impacted by the pandemic?
I think we just need to look around. I clearly was, along with everyone else, involved in this collective trauma. We may all have had our own sort of water-borne vehicles, but it was the same storm, depending on which part of it you were forced to live with. I'm almost more concerned now because I think, to me, agility is how we learn and then unlearn and learn and unlearn. So when the pandemic really shut everything down, we learned and we became diligent and vigilant, and we knew what the limitations were, and this was the limitation, and this is how you lived. I'm more concerned now for people's sort of mental health as they start to get back to the new reality. I won't say new norm. It's the new reality. And things aren't as clear cut. And so there are many more decisions we have to, be angst about.
Mm-hmm.
Do I do this or don't I do this? Do I let my child do this or don't I? Do I go out and visit a client or let clients and we're in a much more, to me, a much more uncertain place, which I think is going to create additional anxiety and additional concerns for what we see in terms of mental health.
Mm-hmm. Yeah, I agree with you. Justine, you've been working in an environment where, in fact, your teams have been present through the entire pandemic. So while we're having conversations and we're hearing about organizations having to figure out how do we bring people back into the workplace, how would you say that you've seen your employees, your staff, teams be impacted by the pandemic working through it on site in your organization?
Yeah, I mean, well, first of all, I commend all frontline workers who have been there the entire time, and that includes, my team, and being able to, at least for me, trying to remember and be aware of the fact that we all have our own lived experience in terms of how we've all reacted to that initial shock of things are changing and they're changing fast. And being able to understand that we've all dealt with it, reacted to it, and continue to do so along the way for over a year. And so being understanding that, whether those who have been at the workplace or not have been physically in the workplace, whether it be remotely, being respectful of that experience. And there's not going to be a cookie cutter way in terms of how we're going to continue to move forward pre-pandemic.
Mm-hmm.
And so the complexity in itself is going to be something that we're going to have to wade and work through together. So respecting that each person is different and unique in their own way.
Mm-hmm. Yeah, I think it's an interesting perspective that you both have, given how you've been supporting your teams. And at the beginning of the pandemic, I was leading a team of about 45 staff and had to pop everybody on in about a week's time to become virtual and virtual service delivery. And so you think about the, agility that you were talking about, Jenni, and how people had to pivot so quickly. And I remember thinking things that used to take us 6 months in a project to, transfer, let's create virtual, we were doing in weeks, we were doing in days. And so the amount of of change and the amount of distress that that can cause people just from a change perspective is incredible. And then, you know, we sort of refreeze into this new norm of working from home. And now we're asking people, hey, do you want to go back to work full time, a couple days a week? Do you want to work from home? Somebody's recently said to me that we no longer work from home, we live at work. And I think that's really being felt by so many people, because they're, you know, as a therapist now and as a coach, I'm listening to people from all walks of life, nurses, teachers, physicians, lawyers, stay-at-home moms, you know, young people, older people, and people are like, I don't have any boundaries anymore from work and home life. It's all blurred together. And so that ability to be able to separate, to walk away from your desk, to think, okay, this is home time, this is time with my family, this is time for me, is blurred. So I find that mental health piece is really challenging to support, both from a leadership perspective, one, because you're not on site with them. So as you say, Jenni, like, we're all working remotely. How do we support? How do we identify when people are struggling? And how do we support ourselves too, when really there's no ability to turn it off? Yeah. What would you say we as leaders, and I'll pose this to you, Justine, what would we say, would you say as leaders, we need to be doing better at to support mental health in the workplace?
I would have to say, going back to the fact that we are all busy, the work that's done within 6 months now has to be done within 3. And so amongst the busyness and the deliverables and all the accountabilities that we have to do in our day-to-day work, it's still being able to pay attention, being aware, and relying on those relationships, those conversations, and as well as checking in with yourself. I think that is key. In order to be able to look after one another, we also have to be able to be aware of what's going on internally within ourselves.
That emotional intelligence has been so important the last, you know, what are we at, 15 months now, 16 months? It
Count.
depends on where you are in the world right now, because if you're in Canada, we're still locked down. If you're in the States, it sounds like it's party time happening everywhere. So the way that this pandemic has been handled is quite remarkably different around the world. Jenni, same question for you. What would you say that we as leaders need to be doing better at to support mental health in the workplace?
I think talk about it. I think that we really have an obligation as leaders to sort of quell or mitigate or reduce the sense of stigma associated with individuals who are really struggling and may need more time for self-care. And I also can't, you know, help but think that we're places of, quote, business. And so within organizations, we, as Justine was saying, we still have deliverables, we still have to perform, we still have to do all of those things. But we can do that and have those expectations with the understanding that we are still not automatons. We're still not, you know, machine-like yet. We still bring whatever it is we're dealing with to the workplace. And so I think talking about it, talking about mental health, talking about, you know, there's the stigma associated with it. And yet I, as a leader, know that if I can help you sort of either talk about something or get you the real help you need, then you're just simply going to be performing better. So it's sort of a win-win all round. And I also think the more we normalize these kinds of stresses, particularly wading through coming back from the pandemic, I think it's a unique opportunity for us to really take a hard look at how we as leaders can, you know, move the needle or really change the climate, if you will. And empathy is a really important tool and a really powerful tool. It's not saying, I feel badly for you, don't do your job. It's saying it must be really challenging for you to be dealing with this and still try and figure out how to perform. How can I help you do that?
Okay. I think, you know, we have to be mindful of how we can still help people be in moving forward professionally, developing, even remotely, even while we're all under this sort of vague veil of stress due to the pandemic. How can we as leaders support our staff to comfortably return or continue to work? And so, Justine, I know that you're probably almost saddling both sides of this, where you've got some staff that have been working from home. You yourself have worked from home as a leader, but then also worked on site. So I'm going to ask this of you first: is how can leaders support staff to comfortably return? What are your thoughts on this after the pandemic ends? And what do you think will never go back to pre-pandemic ways?
Those are big questions, Laura. And really, I think whether we come back to work or not, these are changes, and being able to understand the process of change and the context that each individual is coming from, whether it be the context of their home life, the organization, being able to take that into context of where in the process that they are of the change. Are they accepting of it? What are the things that they are going to need to get through that change within that process? And of course, recognizing, and as Jenni had mentioned, is having those conversations of what is it exactly that they need? What types of, having those open conversations of, I hear you, I want to, being able to validate their challenges and their needs to be able to come back to the workplace. And going back to your latter question, Laura, I think, will we ever, going back to pre-pandemic, it's, we've all have our lived experience, and we can never go back to where we were before that. So it's being able to, what did we learn? What do we continue to learn? And how do we move forward together? And I know I'm speaking in a very broad and general sense, but I think those are some key things that we need to take into context as we transition.
And so if I can put you on the spot, what did you learn? What's one sort of thing that you learned?
I think personally, we, even for me, I've learned how we each have our capabilities and our strengths, how we continue to, regardless of what has happened, what will happen, that we will rise above, and that it's important that we do it together, and being able to be open enough to have these true and open conversations, to be open and vulnerable enough to say, team, I'm actually not okay today.
Mm.
And being honest with that. That is one thing I have personally learned, and I've seen and experienced.
Wow, that takes a lot of courage. And I know courage is something you mentioned earlier, and that takes a lot of courage as a leader to say, I'm not okay. My mental health is not doing well today. And I think that's, one of the ways that we can role model good mental health. So, Jenni, did you have any additional thoughts you wanted to add to that about how we as leaders can support staff to comfortably return to their workplace?
Yeah, so my point of departure around that is really thinking about Grint, Grint's work in around 2010. He spoke about there being different kinds of problems that organizations deal with. And one of them is, quote, the wicked problem. And as a wicked problem, it means that it's not just about a policy that's going to change it and fix it. It's not about changing procedures or putting something different in place and having that sort of fix the problem. A wicked problem really does sort of keep an open mind, require an open mind, require to come to the table to really hear everyone's input, not necessarily a consensus, but to at least be open to hearing what everyone has to say about how to solve this wicked problem. And then people really sort of buying into what the outcome might be and how we can move along. And what I've really learned is that we have to really think strategically. So I believe gone are the days of sort of strategic planning, 2 years out, 5 years out, whatever it is we used to do. I think we just have to learn to really think strategically. You know, this is what's happening. We're seeing it, we're observing it, we're anticipating it. Strategically, what are the kinds of things that we can generate in terms of our thoughts and our thinking of how to move forward? And that sort of sense of resilience is, it's not stepping in place over and over again. You've got to sort of, I think about it as, this is also new. We have to sort of jump off the cliff and grow wings on the way down, which is the courage, I think of, Justine, when you talk about courage. I don't know what this is going to look like. I don't know how this is going to feel. I just know that where we are now isn't going to help. And so here are some of the things we can think about moving forward. And people are not generally comfortable with this sort of place.
Yeah, this is like absolutely change management 101 when I've done, you know, transformations for teams or process improvements. And, you know, it's that if anybody's done any sort of work around Lean or Six Sigma or participated in a Kaizen, it's Wednesdays or Tuesdays, Tearful Tuesday. And Wednesday's that day that you come in and you're like, I don't want to do this anymore. It's too much change. There's too much possibilities on the horizon. And you sort of just think, I can't anymore.
I want to add that I didn't coin this phrase, but I've heard it a number of times. They're going to be what are COVID keepers. So what are the things that moving forward we really want to keep that we've learned about COVID during that time of COVID, and things that have really worked for us, like, wow, we know how to pull together in time of a crisis. So how do we bottle that? How do we, you know, have it so we can unpack it next time when we need it really fast?
Yeah, I love that. COVID keepers. I'm going to steal that one, Jenny. I
stole it. You can have it.
Okay, we'll just steal it all around.
I'm not sure at this point where it originated from.
No, I've been calling them the gifts of COVID. So there's some things in COVID that we've experienced that I'm like, it's actually a gift, but I also like COVID keepers. I'm aware, we have a couple questions left, but I'm actually aware that there's a question and Osas has raised her hand. So if I can invite Osas in to say her question.
Yeah. The question is a bit personal. Yeah, but I was just thinking, since we have Justine as a nurse in the house, would you say menopause triggers mental health?
If you don't mind, if you could just repeat that last part.
Would you say menopause triggers mental health?
I think I am not a doctor by any means, but I think when we take into play hormones, I think that would, on any day, menopause or not, but you know, with any change in hormonal levels within us, that would change our mood for sure. And again, I would recommend being aware of, you know, internally, that self-reflection in terms of where am I at, and we all know ourselves best, and being able to be attuned to that. And that's also a big important piece. I mean, given that in, you know, at least I can say for the nursing industry, or the nursing profession, I should say, it is women dominated profession. So being aware of that, and actually I'm glad you brought that up, because that's something for me to keep in mind as well as I lead my team. So thank you for bringing that up today.
Thanks,
So
Osas.
would you say it's healthy to discuss it with the team?
I think given that, it depends on how well and how open your team want to be able to disclose that. I think it depends on the individual and the context in which the teams would want to discuss that. But it's definitely something to keep in mind, you know, whether a particular staff member or a colleague is not, as Jenny had mentioned, not behaving in the ways that you would know them to be. I hope that answers that question.
Thanks very much, Osas. I think it's a good point is, you know, we're all individual people. We're all going through our own stuff personally, physically, mentally, and we bring our whole selves to work. So question for you, Jenni, and then I'll also ask you, Justine, is how do you as a leader role model good mental health or, you know, good mental well-being at work and as a leader? Jenni?
Well, in my attempt to be purely authentic, I sometimes acknowledge that I'm not really good at sort of taking care of myself. You know, I don't necessarily have a good work balance. I tend to be workaholic at times. But I acknowledge that because I think that we have to bring our authentic self to the table and talk about how when, you know, in everydayness of things, someone says, what you doing this weekend? Just had a meeting with a colleague before this and he said, I hope you have a, you know, good long weekend. What are you doing? I said, I'm catching up with work. You know, so I'm not always a good role model, but I'm always going to be a really good leader in terms of supporting people who want to really take care of themselves and who really want to be able to pay attention to their mental health, whether it's mindfulness, whether it's being able to lock their door over lunch for an hour and do yoga, whether it's needing time off to go to, you know, something, I don't, we not really haven't been out there that long, but whether it's a preschool recital, whatever it is, those are the kinds of things I'm always going to be incredibly supportive of, even though I'm not a purely really good role model.
I appreciate your honesty with us here today, Jenni. And I think that's a reality for a lot of leaders is that sometimes the balance is off with us and sometimes we can't be that perfect role model we'd like to be for our staff. Justine, how would you say that you role model good mental health as a leader?
I think, like Jenni, for me, it's still taking me over 20 years to understand balance. And one can tell oneself to, okay, you're going to take a break today, and that lasts one day, and then the next thing I'm working through lunch. So that's a lifelong learning process for me, is to be able to remind myself to take those breaks, try to role model to my team that yes, I can take a break too. And actually, to be honest, I am off right now. I'm taking a break today. I'm actually home. I'm not at work. And so being able to role model to my team that I need time off, and to be able to respect that. Yeah.
Yeah. No, and if I can jump in, I think it's such a challenge, and I think it says so much about us in the workplace that we sort of want to congratulate somebody, right, when they've taken a little bit of time for themselves, as opposed to it being the most natural thing if that's what someone really wants to do.
Yeah, I would agree with you, Jenni. I think there was a few years ago that I did need to take a mental health day, and I called my supervisor and I said, I'm fine, but I do need to take a mental health day. My cup runneth over. And the response was like, are you okay? Do you need anything? And I'm like, I'm fine, but I just know my personal limits and I do need to take this mental health day. And luckily I was, supported to do that. And I wasn't further questioned, but it was, out of the norm, shall we say.
Mm.
The other piece that I would like to add to this part of the conversation is that work-life balance. I'd like to offer up to our participants is the concept of work-life integration. So, we're not always going to have a 50-50 balance, but sometimes if we think about our work and our personal life as an integration, and sometimes it's 90, sometimes it's 10 that you're giving at work or at home, but over the entire stretch of things, it works out to be balanced enough, but that there's this integration that we're working towards to make sure that we're taking care of all of the major domains of our life, personally and professionally. Yeah. Before we head into our breakout rooms, I just have one more question. Over the course of your career, how have you learned to take care of your own mental health? And Justine, I appreciate your honesty and openness with telling us, hey, I'm on a break today. But Jenni, how would you say that, you've learned to take care of your own mental health over your career?
I think for myself, I have found moments. So sometimes when we think of mental health and we think of self-care and things like that, we feel like we have to sort of carve out this huge time piece or a whole day, or it's all or nothing, things like that. I tend to, and again, I'm self-disclosing because I believe in being sort of real and authentic. There is a song all through the pandemic and through my career, I have found moments in time, whether it's sitting with a cat on my lap, whether it's, you know, in the car listening to music. Through the pandemic, I've listened to Jerusalema. I don't know if anyone knows that song. KG Master, Master KG. So for me, it's those moments of me with a colleague and talking, and someone I was coaching, just as an example, who said to me, I stand every morning with a cup of coffee. I stand on one leg looking out of the window because there happen to be a lot of birds that come to this one tree. And I stand there for 5 minutes, and that centers me and it keeps me going for the rest of the day. And then the transition between work, if you're physically at work, or how you build it in at the end of the day, is usually I'm turning off my computer, I go downstairs, you know, maybe sit with my husband for a few minutes. Those are the kind of self-care moments. They don't have to be expansive or extensive or very deep.
I'm definitely going to try and stand on one foot in the morning with my coffee. Thanks, Jenny. Okay, so I am going to allow you folks that have joined us here today to engage further in conversation with our panelists. I'm going to give you a question. It's going to be popped into the chat, but a question just to get you started, and you know, whatever organic conversation comes from that, that's great too. I'll give you just under 10 minutes with our breakout rooms, but what have you found in your role as a leader or as a team member that helps support your mental health at work? Okay, so that question's now been popped into the chat. I'm going to send you on over to your breakout rooms, and I'll see you back in about 10 minutes. Enjoy. Welcome back, everybody. I see it, most of us have returned, which is great. I'm hoping that we're finding a few nuggets in this conversation today, that there's been one or two things that you can take away for your work as you continue on to support your teams and the people around you. You know, certainly we all want to have some sort of call to action as we leave here today. And so I would just ask if anybody wanted to put it in the chat, or you wanted to speak up, if there was one thing that every leader can do to support mental well-being in their workplace, what would it be? What would be that one thing that you think we should be doing? And maybe I'll hand it to Justine and Jenny first to get us started. Justine?
I think, and this is a beautiful question, Laura, that you've posed. I think for me, the self-reflection is key. Being able to pay attention to where I'm at, and that will help me to move forward, to assess the self-care that I need. And in doing that with my own experience, my own lived experience, and I talked about that before, that also helps me to be in tune with others. Again, respecting the fact that we are all living it differently. But I think that my own self-reflection is so key in that, in order for me to help the well-being of others.
Great. Jenny, what would you offer?
I would completely echo what you've just said, Justine. It's really hard to sort of give if your cup's only half full, right? Or not, or completely empty. I would also add the one thing that resonated again with me, even in our small groups, the discussion that, for example, Adam shared with us, and Lauren and Cynthia, and I think I may be missing someone, forgive me, is that open the dialogue, just open it up for dialogue, acknowledge that these are particularly challenging times, and how we can work together going forward, and talk about expectations and talk about ways that we can mitigate stigma. So I think giving people permission to acknowledge mental health is what I'm validated in taking away with me again.
Yeah, absolutely. I think there's a way for us to also offer up normalizing mental health, mental wellness in the workplace, but also helping people have greater emotional literacy, like understanding that our emotions are normal, that we should be able to bring our whole selves to work, that we are often many families in the workplace as well. So just trying to open up that acceptance. And I think, that's a COVID keeper for me, is that we all have seen each other's families now for the last year. We've heard each other's dogs barking and, the craziness that goes on in our home. So if anything, it's opened us up to be more exposed or more vulnerable with our teammates as we go forward, because we've all been living in each other's houses for the last year. So we've got 1 minute left, so I'm just going to invite people, if you had one of those, sort of COVID keepers that you wanted to add into the chat, go ahead and put it in the chat now. And also, if there's something that you think as a leader you can do to support mental well-being in your workplace. And as we watch those ideas popping into the chat, I'd just like to wrap us up by saying thank you very much for joining us today. It's been our pleasure to be able to come and share with you our experiences and our expertise. This is just scratching the surface of the conversation around mental health in the workplace. We definitely know that there is more to be spoken about around this topic. GLI will continue to be offering monthly webinars. If you want to become a member with GLI, you can get access to free coaching with someone like Jenni or myself, and speaking with other content experts from around the world. We will be having another webinar in June on Indigenous leadership. So please make time in your schedule to join us for that. Like us or subscribe or however it goes on LinkedIn. We'd love to have you back with us again next month. Thank you to my guests, Justine, and to Dr. Jenni, for joining us today. It has been my pleasure to invite you to this table. And thank you to everyone for coming and joining us over your lunch hour, or wherever particular time zone you're in right now. Be well, stay safe, and have a great day, everybody.